Welcome to another episode of Beauty Talk Podcast brought to you by G Skin and Beauty Institute. Today, we are thrilled to have Dr. Atanu Biswas, a renowned cosmetic expert and thought leader. With over a decade of experience in cosmetic and reconstructive surgery, Dr. Biswas is not only a master of flawless surgical techniques, but he's also a compassionate advocate for patient well-being. He brings a unique perspective to the body image, self-esteem, and mental impact of cosmetic enhancements. So stay tuned as we dive into the innovative approaches and procedures and gain insight into the emotional journey of cosmetic transformations. Dr. Biswas, thank you so much for joining us today and for being on here and sharing all your knowledge with us.
Oh, well, thanks for having me. It's my pleasure. I'm happy to be here.
Awesome. So tell us a little bit of how you got into this industry, into the field, and how you specialize really in the mental health of patients before they're going under reconstructive surgery and cosmetic surgery.
Yeah, so I trained after medical school for about like 5 to 6 years in general surgery at the University of Arizona, and then I did my plastic surgery training at Mayo Clinic in Arizona. And when I noticed a lot of the times patients sometimes would have a lot of questions and concerns even after a consultation. And most of it stemmed from the fact that, they weren't well informed as far as like what to expect. And so from a, mental standpoint, I think the most important thing that you can tell somebody or, tell a patient is that here's what you can potentially expect, when you're having a surgical procedure and then what the kind of timeline of things are. I think the more they're armed with that kind of knowledge, the less stress it is for that particular person. And I think it will impact their overall, healing course because their stress levels are going to be much less.
Okay. And well, that kind of leads us right into our first question. So, can you share how these cosmetic procedures are affecting the emotional and mental health of your patients?
Yeah. So, I think patients overall have a certain, motivation to come in and have a cosmetic procedure. And it's important to understand what that motivation is and if there is a realistic type of, or achievable outcome for that patient. And so when we're approaching somebody from that mental health standpoint, I think it's really important to kind of figure out and tease out their overall kind of what it is they're trying to go for. But at the same time, if to see if it's something that it's coming from a proper place. Is their motivation coming from a reasonable point of view, or if it's something that is maybe throwing up a little red flag in the sense that is this going to be something that's going to impact their healing if we proceed with the certain type of procedure?
Mhm. And so, how do you go into? I know this is part of like your consultation, but what are some of the red flags that you see where you would say maybe this isn't the right time for you to go through this?
Yeah, I think most of those red flags are going to be, when you see a patient and let's say, for example, they have some emotional, distress and that's visible. And that's to see it on their face, maybe in their body language. Um, kind of, figuring that out, understanding that and really kind of teasing that out so that way you understand, like, maybe their overall stress levels are a little high depending let's just say for example it's like someone's going through like an active divorce or if they're financially in a certain predicament, or if they're maybe going through some kind of breakup or if it's a job related issue. You want to make sure that these types of things are not the motivating factors because usually it's going to lead towards unrealistic expectations and potentially even worse issues such as problems. The reasons why I say that is because when you're going through stressful situations, stress, usually, on the cellular level, it's going to cause some degree of like an increase in your cortisol levels. And if you have an increase in cortisol, which is a normal stress hormone, your actual impact of wound healing is going to be negatively impacted. And so, which means that you may not get the best scarring outcomes. Maybe you develop a wound. And so when you're trying to go for an aesthetic procedure, you don't want these types of problems to impact how you heal and how you look. So we want to optimize patients based upon what they're trying to achieve. But a lot of it has to go into like what is their mental health status at the time of the consultation going into the procedure to make sure that we're doing it at the right time and for the right reasons.
Okay. And in your experience, how do these aesthetic enhancements overall help your patients after they have had the treatment?
I think by the vast majority of patients that we go through, especially after they had appropriately screened, have high satisfactions. To the point where, like, we have patients say that, certain types of procedures have changed their life completely. That's a real thing that we hear. You can do a procedure such as like a tummy tuck with liposuction, and almost re-deliver their body back to them as they maybe had prior to pregnancies, for example. You can literally probably bring down somebody maybe 4 to 6 sizes in their clothes. These types of things have a positive impact overall on their overall well-being, and not only from a cosmetic standpoint, but also from a functional standpoint. You may have liked to previously do certain activities, maybe play some certain sports, maybe exercise in a certain way that you're not able to, maybe after either a pregnancy or gaining a certain amount of weight. But after you have, like, so say for like we're talking about like a tummy tuck with liposuction, and you actually are able to bring them down to maybe 4 to 6 sizes down, and also debulk some of the fat that's underneath the skin, tighten up their skin, and so that way there's nothing hanging over into their waistline or their pants or anything like that, and that will actually improve their quality of life in the sense that now they can probably do those certain activities much more confidently and without being obstructed by maybe extra skin or fat.
Yeah. And I think right now, I know the big trend in this area in Illinois is all these weight loss, like the semaglutide. I don't know if I'm pronouncing it
It's
properly.
semi-glutides.
Semaglutide.
Yeah.
I see a lot of women are doing this. And I can only imagine after losing a significant amount of weight that they would have these tissues that are not where they used to be or that they hoped that would come back or retract.
Yeah. Yeah, I think like when you take, semi-glutides, I think they're fantastic. I do think they have their role, because I mean, you have somebody who has maybe a lot of, let's say, adipose or fat, whatever you want to call it, that they're carrying underneath their skin. Well, you take these medications, and almost like magic. I mean, a lot of that fat can actually, shrink down. Um, Obviously, when you debulk or when you lose a lot of fat or weight very quickly, a lot of times your skin does not have time to recover or to kind of shrink down with it. And that is a just a known kind of side effect of taking a semaglutide. It's the same thing if you have like one of those bariatric procedures. You lose a lot of fat very quickly, and that pillow of fat just shrinks down so fast, and the blanket of skin that's sitting on top of that just crumples down because it doesn't have the time to contract right. So what you get left with is a lot of loose excess skin. And if you did already have a lot of skin that was hanging down over maybe your waistline, maybe even from other areas such as your arms or maybe your inner thighs, well, it's still going to be there. Okay, and so that's when plastic surgery kind of steps in, and we can really help remove a lot of that excess skin and really try to tighten that skin back up again. And so that's an excellent role for plastic surgery.
And I think it also is a supportive role to the, injections. So now they've, reduced all of this weight that they probably weren't able to do with diet and exercise before. And now this will now even further increase their self-esteem because now they see themselves in the way that they can imagine.
Correct. Yeah, I think it is definitely part of the holistic treatment of somebody who is trying to ultimately get to their overall, maybe cosmetic goals or functional goals or a combination of it.
Yeah, I love that. I love it. So, in choosing the right doctor, and we kind of went deep into this a little bit earlier, and I would love to really educate the audience in the differences between just a regular surgeon and a board certified surgeon. So, when people are coming out to look for a surgeon and they're looking for these procedures, what are some of the recommendations or things that you recommend them to look for when seeking out these professionals?
Yeah. Rehabilitation won't get out and board certified, and you could board certified in plastic surgery. So, the United States has accrediting medical services, and they only recognize certain, board organizations. For plastic surgery, that's the American Board of Plastic Surgery. Okay. And so there are other, let's say quote boards out there, but may not be recognized by the actual American Board of Medical Examiners. Okay. And I think it's important to, ask, what is your board accreditation? And then they can look that up themselves to see if that's actually an accredited board specialty. Okay. Now, the reasons why you want to have, you want your surgeon to be board certified is really two things. Okay. When when you seek out or when a plastic surgeon goes through the board certification process, it is a rigorous process. And that purpose is to test for a couple of things. Number one, you have to know like the knowledge base to be able to do plastic surgery. It's not just only knowing a superficial idea of maybe how to perform the procedure, but you have to be able to take a person or a patient from step A all the way to Z, and maybe even any tangential types of things that kind of come off of it, and be able to take care of those issues. Okay. Because the practice of medicine is we have relatively predictable ways of how to proceed with things. But once in a while, you can develop issues that are unforeseen, a complication or something like that. And you want to have somebody who understands the breadth of plastic surgery to know what is appropriate and how to treat certain things, especially in the appropriate times. Not everything needs to be addressed immediately. Not everything needs to be addressed later on and punted down the road either. And so the second part to understanding, or the reason why board certification is important is because that is also testing for how safe somebody is. A plastic surgeon's rigorous process through board certification is also really testing to see how safe one is as they, go through the whole process of performing plastic surgery and seeing somebody in consultation and then managing them afterwards. There's ethical standards, there's safety standards, and that board certification process is seeing if you know those standards. You don't want somebody who, isn't board certified that may be just making it up as they go, not following the standard principles, skirting the, proper techniques, skirting, possible like ethical issues too, because those have other worse ramifications if you're not careful with that. There's a third issue too, and it's that it's not something that's normally talked about. And I think the first two things we talked about are relatively kind of self-explanatory. But the third issue is that hospitals typically require those who are applying for certain privileges, like say for example, I want to apply for privileges at a hospital in the field of plastic surgery. They're going to want to see that are you board certified. If you are not, you may get denied or privileges at that particular hospital. Well, what does that mean? Okay, so let's just say, for example, you're not a board certified surgeon, maybe not even a plastic surgeon at all. There are people out there who are not even plastic surgeons who are performing cosmetic operations, have no board certification, and they have no hospital privileges. Let's say, for example, you do a procedure on a patient and they develop an issue that is severe enough that required them to be admitted to a hospital. And if you do not have privileges at that hospital, now you cannot take care of that person. So how does that person get taken care of? How does that person get taken care of? Well, it's going to be taken care of by some plastic surgeon that does have board certification. And now you're going to get exposed, in the sense that, you don't have the proper credentials to be practicing the specialties. And that leads to legal ramifications as well. So it's a very, sticky area, a very big liability issue for those who are not board certified. Okay. And so that's one of the things to look into. And I think, knowing that your surgeon is board certified gives you at least that, comforting factor, knowing that like you're going to be taken care of in the most proper way. And I think that's what it really means.
Yeah, and I think that we briefly touched upon this, and this is just for you guys, the audience. Just know that if you, by some chance, end up going to a surgeon who is not board certified, the emergency room will not reject you. Like you will still be seen, you will be taken care of by somebody who is. Thank God for the United States and some of these policies, but also do your homework because you want somebody who's going to be able to handle your case from beginning to end.
Right.
And if something does happen, you would hope that that would be the doctor to continue your care.
Right.
Yeah. Okay. So then, in your journey outside of the patient and the operating, how do you prepare them for this? What is like your protocol? If I'm going to come in and say, Dr. Biswas, I want a mommy makeover, what is our first step?
Sure. Yeah. I think, the process is very important. And the way that we do that is that, when you first come in for your consultation, just like any medical visit, you're going to get, you're going to we're going to take a history on. So a medical history to kind of understand, like, what kind of medical, you know, possibilities, are going to impact your overall healing if you're going to pursue a certain type of procedure. And that can be anything from like certain medical, ailments that you might have. And it also can mean like, with certain medications you might take. And so the reason for doing that is because we have to look at, the patient as a whole. And what we're doing is we're risk stratifying patients to figure out, are they going to do well with this type of procedure from the technical aspects, from a healing standpoint? Are their scars going to be okay? Also, are they going to be able to tolerate anesthesia? What's their overall pain tolerance going to be like? And are there any, possible other types of, medication interactions that we may have to be aware of, such as like, taking a medication that might cause, extra blood clotting or bleeding for that matter. We need to know these things prior so that way we can optimize your overall healing. After we do the medical history part, then obviously we're talking about what it is that you want to do, and what your goals are, what your expectations, would you like to improve, and again going back to the kind of the mental health aspect, we're trying to see, are you approaching this from the proper point of view? Are your motivations, realistic? Are your expectations realistic? And not only that, I'm also evaluating to see wherever I can deliver is achievable. I
Mhm.
don't want to necessarily, have patients come in and me try to like tell you, oh yeah, we can do this, knowing that I can't achieve those results. Okay. Because they might be out of the scope of possibility. Okay. So that's, what we're kind of really trying to figure out and pin down during the consultation. Then let's just say we've gone through all that, and then, we identify you're a good candidate for surgery. You have realistic expectations. We have realistic results we can provide for you. And, we go through the whole process of kind of going through the preoperative, consultation. We'll meet the nurses. We'll get printed and verbal instructions. We'll get your medications prior, and, we'll talk about the procedure, and then, some of the technical aspects. A lot of the expectations about the timeline of healing. The timeline of healing, I think, is very important. Going back to what we're talking about as far as reducing the overall stress for the patient. I think when patients understand that, like, expect you to feel like this at week one, from week 2 to 6, you're going to feel like this, or you're going to notice these types of changes. From week 6 to maybe 3 months, you're going to see these types of changes, etc. Okay. I think when patients have a kind of a framework in their mind about what to expect, and then they actually see that occur during their healing process, it lowers their anxiety levels significantly. Cortisol levels are decreased, their overall stress, and, overall confidence in knowing that their results are following the typical protocol. it- That it greatly impacts how their overall healing and their satisfaction with the results will be. And that's kind of the challenge.
Like the little pathway to getting our surgeries done.
Right.
And then after that, like what after the surgery and everything is done, what happens then? Do they come back? Do I come back see you? Do you check on
Yeah.
me?
Yeah, after the surgery is done, I mean, depending on what type of procedure you have, there, we kind of have like a kind of a regular routine on when we see people. For example, let's just say we do like a tummy tuck. Okay, tummy tuck, maybe with some liposuction, something like that. Typically, I'll see somebody at week one, maybe week two if they, when they have drains in. Okay. And then maybe at even week three to see if they have belly button stitches that need to take out. And then I'll see them at week six. And a lot of times the reason for seeing people at week six is because my typical, trend for patients is that if you're going through the process and it's going as predicted that we would expect, typically at week six is when I release patients to going back at full normal activity. Okay. And so at week six, I like to see people just to kind of give them that type of, okay, let's say I give you the blessing. Okay, everything looks great. You can get back to normal activity. Then I see you kind of at I'm just giving you at 3 months, maybe 6 months, and then a year out. That's a kind of a typical timeline. And it will vary depending on the procedure. On some other, procedures, you might not require quite as, regimented follow up. Some, such as like a facelift might require even more. Okay. So it really depends.
Okay. And can you explain some of the latest innovations of the minimally invasive non-surgical treatments for rejuvenation that you guys are doing?
Yeah. So, minimally invasive techniques, kind of span a broad range of things. Many people understand or know about Botox and fillers and things like that. I think, like, when it comes to surgical technologies that are minimally invasive, most of it is kind of concentrated towards, skin tightening. And that ranges from, you'll hear about lasers, you'll hear about radio frequency. There's another type of technology called helium J plasma that certain brand name is called Renuvion. And when I explain those types of techniques to patients, especially when they're coming in for consultations, I try to let them because I don't like them to get like fully bogged down on all the terminologies and the different texts and like, why would you use one versus another? I usually try to tell them, I go, all of those technologies pretty much do all the same thing. The difference is the technology's delivery method is what's the difference. And really the same thing that they're trying to do is deliver a controlled amount of energy with this heat to the undersurface of the skin that help try to contract the skin and maybe shrink the skin and tighten up the skin. Okay. Depending if you use radio frequency versus a laser versus Renuvion, that really depends a lot of times, on the plastic surgeon on what they're comfortable with. Because there are nuances with those two technologies on how to get best results. And sometimes, like a plastic surgeon may be more comfortable using radio frequency versus the Renuvion versus a laser. Okay. But that's kind of like, the where the majority of minimally invasive techniques, are, concentrated. There are other things like, endoscopic techniques, such as like brow lifts. They have their place. There's things like when you're talking about like, with an alternative facelift, there's these things called thread lifts. Um, I'm sure there's plastic surgeons that do some of that. It's not something that I like to do. I think there's not a whole lot of, um, let's just say, um, wiggle room when you do a thread lift because typically you can't really reverse it. It's hard to do. If you're off by a certain amount of degrees on how you place those threads, it's going to show, and it's not as controllable as a base.
I've seen that. I
Yeah,
saw where it almost looks like a tent.
yeah,
Who pitched a tent in their
yeah.
knees.
They kind of like real pucker, or
Yeah.
so it had comes with its risks. And so for those of us who do facelifts and things, obviously a facelift is just way more superior. And so that's
Mhm.
what we would if somebody was coming in with something like a thread lift or something like that, we would probably, steer them, towards doing a facelift because you just know that's more reliable. It's probably more
Mhm.
long lasting. And we can control for different, what we call vectors, meaning the way we pull things in a motion pull bed.
Yeah. And I'm sure you're kind of eliminating a little bit of the infection component of doing a surgery like that because I can imagine implanting something gives you a higher risk of complications.
Yeah, I mean, I think like essentially it's a stitch that you're just kind of threading a needle through, and that stitch has to dissolve ultimately at some point. So those results will probably reverse, and they can reverse relatively quickly. Um, and obviously, if that stitch is contaminated anyway, yeah, you can definitely develop an infection. Um, but yeah, I think like getting reliable results, symmetric results. It doesn't have that much of a um, yeah, this doesn't have as much of a wiggle room, I guess you'd say. Uh,
Wow.
and so yeah, it's not as popular, but
Yeah. Well, and I love that you're still trying to educate your patients and saying, okay, maybe you had this idea of what we could do, but this is really, after speaking with you, consulting with you, this may actually be a better
yeah,
treatment for you.
I think it's very natural for patients to come in and they automatically will gravitate to the thing that's going to be less aggressive, and that's natural. I mean, we all would like that, but in some respects, we understand that. But a lot of times, like when a patient comes in, we can kind of figure out like again going back to like what their overall goals are, and we know that the goals sometimes from these more minimally invasive type of techniques just aren't gonna do what a facelift is gonna do or what a tummy tuck is gonna do. And when they're describing what their goals are, they're basically describing what they want from maybe a facelift would give them, or maybe a tummy tuck. But yeah, we understand that there's reservations about having scars and a larger surgery. But I think it's important to kind of distinguish between the two types, what you can expect result wise between the two.
So, how are you managing these patient expectations when they do come in and they're saying, hey, this is what I want, but you're like, okay, what you're really talking about is a facelift? Like, how do you go about that?
I say it just like you said it just now. They'll say like, I want this, but maybe they even start off saying, I'm not ready to have a surgery, or I don't want to have to do something extreme. It's like, but I want this pulled. I want this to look like this, maybe they'll show a picture of somebody or on something on they found on the internet of a similar type of appearance they may be going for. And I will literally say, it's like, okay, I do think we can achieve this, but what you're really asking for is a facelift in order to do that. Right?
Okay.
All of these other techniques just won't, get you there because they have their limitations. They can't have the full control of maybe some of these other procedures. Sometimes an aggressive procedure is designed that way because it gives us the control not only to like, move things in a certain direction or multiple directions for that matter, but also to address multiple tissue types, maybe not to skin. So a lot of the minimally invasive things only address one tissue type, and that's usually going to be possibly skin, for example. Um, and so, if you're, say, for example, with a facelift, a lot of times it's not only the skin, but there's a layer of tissue that sits underneath the skin. It's a large word, or a long phrase. We call it the superficial musculoaponeurotic system, which is a fancy way of saying the muscles and the tissue that wraps around the muscles that sits underneath the skin are also last. But in a facelift, we can address that. We just can't address that with all the other minimally invasive techniques. And a lot of times, that's kind of one of the key areas that needs to be addressed in order to get you some longer lasting results.
Okay.
Excuse me.
So, yeah, thank you for the breakdown because I think a lot of us really don't think about all the different layers. One, we're not educated on that. That's not our specialty. That's
Right.
how we come to you guys.
Right.
So I love that you broke it down in that way. So right now, what are some of the trending treatments that you're seeing and that you're really excited about?
Yeah, I think the trending treatments that we're seeing. Um, Obviously, Botox fillers are all very popular, and that continues to be very popular. I do think like you're seeing a lot of people coming in for like, you know, um, still getting body contouring procedures, liposuction, and then using these types of skin tightening technologies with liposuction and become increasingly popular. Liposuction as a whole, and this has been a trend that has been relatively consistent for probably a decade, maybe even more. Liposuction has been the most commonly requested, plastic surgical procedure. But the thing is, we're trying to figure out ways how to optimize liposuction because a way to look at liposuction is that like you have a pillow of fat and you got a blanket of skin sitting over that pillow of that. Well, liposuction typically is going to basically eliminate pillow. We're just basically yanking the pillow out of there or sucking the pillow out for this matter. And but that blanket of skin is still there. And that blanket of skin may just start to crumple down. And so we want to try to be able to remove as much fat as possible, but also have some of that skin heal in a way that is as smooth as possible. And obviously that's, a little bit difficult right now because we need better technologies to actually influence the skin so that way it tightens up. Well, we do have some technologies that help promote that, such as we were talking about radio frequency, which if you look online, there's a brand name or, a kind of a company that, is called InMode and makes what's called the body type devices or the neck type. Very common area is doing liposuction to this neck area, but we add this radio frequency probe to basically help and promote the skin to basically tighten up and contract. And so that's done at the same time as liposuction. And that really can help augment the overall results of the neck profile and get you very excellent results. And you can do the same type of thing with the body itself. Using things like Renuvi on it is very similar. Just like I said, delivers that energy in a different type of way. But the end result is trying to achieve the same thing.
Okay, good. That's really good. So we have a lot of options, ladies. And I also asked this before while we were not filming, but they can actually do these treatments at the same time that they're doing your lipo
Yep.
and all these other things. So you don't have to like go under once and then come back. Like they could do it all at once, which is
A lot of times, you can actually do this awake, meaning that like you don't go under a general anesthetic. There are ways where we can do this, where we have a dilute lidocaine solution that we use to numb up the areas that we're going to work on, and we can do that while you're completely awake without a general anesthetic.
oh my gosh, that's so crazy. I've never heard of that.
Yeah. Oh, so awake liposuction is definitely something that is also becoming very popular. Because yeah, patients, on the whole can avoid having a general anesthetic. It may be even cheaper because you're not having to pay an anesthetic fee. And so they can get, a procedure with a less amount of cost, still the same results, and can still do all these other techniques such as the skin tightening stuff with this type of process.
Doc, so why would somebody choose to be awake during a treatment like this?
It's a great question. I think, some patients may have some aversion of going to being asleep with an anesthetic from a general anesthetic because, maybe they feel that like they may end up like having like an issue with their heart, maybe their lungs or something like that. And, even though that risk is very low, patients may have had known somebody or had a family member who may have had like that kind of same issue, and they're a little bit averse to having that done to them, and they don't want to have to deal with that potential issue. That's perfectly valid. Or a lot of times it's down to a cost. It's something that they can do, and it's cheaper, and they have a sense of themselves to know that like, okay, yeah, I think I can confidently do this and feel fine. And a lot of times patients feel perfectly fine. Everyone's
So nuts.
once in a while you can get somebody who like, feels something, maybe a little, feels like a little pinprick or a burning sensation. But
Mhm.
I would say 90 to 95% of patients are perfectly comfortable. You have patients that have said it feels like a massage. I have a patient that I was doing awake liposuction on my Instagram who said the dentist is worse than having the awake liposuction.
I mean, I
So
could probably relate to that comment. Yeah. I mean, it's like I love going to the dentist, but it's like a love-hate thing. Like, just don't find any cavities because
right.
the amplifying of that drill noise is just,
Oh yeah,
oh,
I get it.
repulsing.
Yeah.
Yeah. That is
Yeah.
so crazy. I've never heard of anything like that in my life.
Oh yeah.
So
Some patients say it feels like just a massage. It's it's pretty wild.
that's wild. But I mean, I guess it's good. And especially for maybe those people that want to have a little bit more control.
Yeah.
I know there's a lot of those type A women around that they just want to be awake for this. So this is
Yeah.
also maybe helping their cortisol levels.
Absolutely.
and faster healing and all those things. So that's really cool.
Well, and also, like, when you have a general anesthetic, sometimes there's a little fog that you get after having a general anesthetic that patients just don't like, that feeling of. Obviously, you're not going to get that when you have an awake liposuction because you're not getting that general anesthetic. So your overall clarity comes back a lot quicker. And I think that
Yeah.
gives them, like, you're going back, what you're saying with that control feeling, that they're more in control of their own body at that point and not like, wondering if that clarity is going to be something permanent or, or take a long time to get rid of.
Yeah. So, still kind of going in with like these type A patients and all of that, how are you dealing with them psychologically and emotionally after they have the treatments done?
Yeah, I think going back to, when you have these treatments done, explaining to them beforehand, here's what to expect, on your healing course. Okay.
Mhm.
Uh, they got their instructions, they have, and we're always accessible. So that's also a big part, being accessible for patients, when they have questions. But yeah, explaining to them like, at this time of your healing, expect this. At the next phase, you're gonna see this. And when they start seeing that in real time, it gives them a huge boost to their confidence, knowing that they're following the process. You know, a lot of times, like, we tell patients, trust the process, and once they go through the process, they're like, okay, all right, I see what's happening. All right, this makes sense. Especially
Yeah.
when they said, oh, well, doc even said this was going to happen. And that really helps them know that, okay, this is
We're good.
this is moving like we would expect it to.
Yeah. I'm definitely one of those people. You got to tell me everything that's going on. It's like I need to follow the recipe. I need to know all the things.
Yeah, absolutely.
Okay. And so what are some of the challenges that you as a doctor kind of, have to deal with during these procedures?
Yeah, I think like medicine and surgery is ever changing. It's always constantly evolving. Um, and with that, we have the challenge in the industry is basically keeping up with whatever trends and changes that are occurring.
Mhm.
It's a double-edged sword, okay, because there are a lot of technologies that get put out there, and sometimes we don't know if they've been accurately vetted. And a lot of times they'll say that this is, a better tech than maybe what you were using before. And sometimes that may not pan out. Unfortunately, sometimes we're learning that by trial and error. And so I think like when you kind of get to a point where you're comfortable getting reproducible results with a certain technology, then you'd have, as from a plastic surgeon's point of view, we would tend to have more faith in that particular company if they come out with some newer model or something like that to kind of
Mhm.
say, yeah, we use the same existing technology. This is how we optimize it. Because at that point, we would probably understand it better. Sometimes when you get competitors into the mix, which you're always going to get, it's hard to kind of filter out, like, are they truly better than what we're already currently using? Um, Sometimes we have to experiment and I hate using that word because you never want to be experimenting on patients.
Mhm.
But the thing is that in the realistic world, is sometimes you're
The only
the only way to know if that is actually truly better or not. And so we're generally skeptical, and I think that's a big industry challenge because the doctors and surgeons are generally skeptical when something new comes out. And
Yeah.
we tend to stick to our ways a lot of time when we know we can get reproducible results in a certain thing.
Mhm. Well, and I'm
That,
sure your guys' brains too, and I'm sorry for interrupting.
yeah,
You guys are data based.
yeah, yeah. We're constantly evaluating the scientific literature. We're seeing what's out there. We're seeing what the data shows. And the data, when we evaluate data, it's not just only evaluating just because it's written or published or something like that. Sometimes data that's out there is not great data, you know?
Mhm.
So we're trying to evaluate are the studies that have been published, are they good studies that really will be impactful if I were to adopt whatever there is that they're, showing that give you some statistical value. Sometimes that's not always the case. And so it's important for doctors to be, constantly reviewing medical literature and keeping up with the skills and even how to vet, the data to understand what's real, what's useful, that kind of stuff.
And it aligns with your practice and what you do too, on top of that.
Yeah. They're like part of that double-edged sword I was talking about is that like sometimes we get to a point where we're used to using certain technologies. And at some point there is something new that does come out. But because we're skeptical,
Mhm.
maybe that new technology is actually better. But we're just somewhat stubborn, because we're used to doing it in a certain way. Now we're missing out on getting better results because, we'd rather not change our way, in a way.
Mhm.
So, that's the constant battle that we play.
Okay.
I
That's
think
the challenge.
yeah, but it is good. I think the plastic again, when you're a board certified plastic surgeon, there is a network. We have a huge network, the American Society of Plastic Surgeons. We have national meetings, and we can go to these meetings, and people will give us, other surgeons will give you their, results, their data, their research, their opinions. They'll have
Mhm.
panels where they're with moderators, you know, in debating, the pros and cons of all these things to try to achieve some degree of consensus on like, okay, is this a useful thing or not? And even the audience, when if you're out there in the audience, like you can give your opinion if you use these types of technologies. They kind of like help everybody else figure out if it's something they want to try to use in their own practice.
Yeah. Well, yeah,
So
we always say like on the top, it's collaboration, not competition,
right,
right? We're just sharing individual experiences. And
right.
there's maybe practitioners that have graduated well after you have and were exposed to something different that they could introduce and educate you
Oh yeah,
on, and
absolutely.
vice versa.
Yeah, yeah,
Yeah.
constantly.
So with all of these innovations, and advancements, how do you see this shaping the reconstructive and cosmetic world?
So I think like you're probably going to see a big push towards, you know, more innovations with the technology for skin tightening. And again, like, usually you see these things because markets tend to follow trends. And you have things like Ozempic and semaglutides, Mounjaro, those types of medications that are, doing really well with like, patients losing a lot of like fat, but you get a lot of skin laxity afterwards. Okay. And
Mhm.
not only that, Mother Nature is always there. She's always working against us, unfortunately. And, you know, gravity is always around us. Our skin will get more thin, we'll get more lax. These are things that unfortunately we can't avoid, but we can try to, help augment and maybe delay these types of things, based upon new innovations and skin tightening to that effect is it's gonna be really the big industry there. So maybe you might see, new energy technology, something that is different from a laser or radio frequency or just helium J plasma removing on or microneedling or whatever it is that it might be something we don't even know about that's may come out within the next 10 years. Who knows? And that might be a game changer. The future is yet to be written. So, we'll kind of just patiently wait and see. But that's where I foresee things because, and then fat loss. Now there's, like we said, there's a pill. You can take a semaglutide or a shot and you can reduce that fat. That's minimally invasive, right? It's just something you can take just without having a surgery to reduce that. Um, but we have to address skin in a better way. So that's where I pursue things kind of going. Um, and hopefully we get something really, really in that, that's really game changing. I mean, that'd be like what we love to see.
Oh, yeah, from your mouth to God's ears. I know all of us just want to be tighter and younger.
Absolutely.
That's just what it is.
It's what it is. That want will never go away. Put it that way.
Yeah, and
Doesn't matter who you are.
I even see it in men now too, which
Oh
I'm
yeah.
happy. I'm
Yeah.
happy that they're finally like just loving on themselves enough to say, you know what? Maybe I do want a little eye lift or a facelift even or a little brow something.
Oh
So
yeah.
yeah, I'm happy that this is expanding to your guys' demographic as well.
Absolutely. We see
Yeah.
plenty of men. Yep.
Yeah. It can't just be like us women looking super great and then our guys like aging, right?
Yeah, I mean, from a I don't know, a societal thing, who knows, then typically will, be less, you know, but that and we're seeing trend, we're seeing shifts. Like we're seeing a lot of guys who are coming in for all kinds of different things. They get liposuction, they'll get, esthetician services,
Yeah.
facials, microneedling, lasers, facelifts, even
They
tummy
don't
tucks
keep up.
sometimes.
They don't
So
keep up.
absolutely. So, there's even like men's health wellness clinics specifically just for men, that are popping up. So it is a booming industry. So I mean, there's definitely changes that are occurring there, and I think that it's becoming less taboo for guys to go out there and want to look better. So
Yeah,
yeah,
that's great. I'm happy for that movement and for all those guys and also my women that take, great care of ourselves, that the men are actually putting a little bit of effort behind it too.
oh yeah,
Yeah, and that's really good. That's really good. Well, Dr. Biswas, this was a pleasure. I feel like we learned so much. And
absolutely.
I can't wait to share this with everybody else and educate people on what you do, and that it's not only just about surgery and reconstruction, but it's your overall holistic health. And there are doctors out there that care about it all.
Yes, absolutely. I think it's very important, to take every patient, as a unique, you know, being to kind of treat them from every angle because overall, if you can optimize results medically, physically, even spiritually, for that matter, I
Mhm.
think you can really augment your overall results in that matter.
Absolutely.
And I mean, it's clear. It's very easy to kind of see that, and especially if you are a person who have gone through that, you can attest to it. And I think it's very true. So
Yeah.
I think there's a lot of things, on the even from the molecular level all the way to the complete physical external level that are impacted by treating somebody holistically.
Perfect. Perfect. Well, once again, Dr. Biswas, thank you so much for your time.
Absolutely.
And for making time in your busy schedule because oh, you're like crazy busy.
Yeah, it's always fun to do like these things. It's important to get like education and some kind of framework and context around things. So glad you
Yeah.
guys are doing this.
Yeah. Thank you.
Yeah,
Thank you. Thank you. And what we wanted professionals, right? Because a lot of our education comes from TikTok these days.
yeah,
So
yeah.
we wanted to get like the real thing.
Get it.
So thanks again,
You're
doctor.
welcome.
And thanks for your patience for everything.
Absolutely, a pleasure to be here. Thank you very much again.
Thank you for joining us on today's episode of Beauty Talk Podcast, sponsored by G Skin and Beauty Institute. We hope that you found this conversation with Dr. Biswas not only insightful, but also super inspiring. If you're considering a career in beauty, please visit gskinandbeautyinstitute.edu to learn more about all their amazing programs. And don't forget to follow Dr. Biswas at Biswas Plastic Surgery for more of his incredible work and us on all of our social media. And until next time, stay beautiful and confident.